working across organisations is quite hard. So it helps if you have a working relationship and some trust and history of working with your colleagues before you try and build up a bigger collaboration. And then I think there's a question about, what's the added benefit of being a HIT? Why would you want to do that? What extra benefit do you see from it? And part of that is about what are the key players who are missing, who you might be able to bring in. So that might be voluntary third sector, it might be the clinical commissioning group, it might be the city council, who are a very active player in some of the HITs, as Marcus will talk about later. So I think there's something about thinking what would strengthen our group, what would help add to the research, but also to the implementation and possibly to the educational initiatives, quality improvement. And what are the benefits? Do we need to have that stamp of approval? Do we need that legitimacy? Do we need that recognition about what this will bring? And I think part of that is, as David says, about external facing and also about connecting with the public. There's no doubt we've had a number of inquiries through Bristol Health Partners already. Then one of the really tricky things, I think, is working out whether and how your work aligns to the priority of the different players. So finding out what the different organisations' priorities is quite hard. You'd think it would be quite easy, that they would all have their own list of priorities easily available, but actually finding out how you can argue that the work you're doing links with the key priorities of different organisations, because it's no good at just aligning to UWE, it's got to align to UHB, it's got to align to the City Council or to the commissioning group, can be quite difficult. And some of them are obviously really obvious, so the preventing emergency admissions HIT, it's pretty obvious that maps onto absolutely everyone's priority in the city. Active older people is probably mostly of interest to the City Council and the commissioning group, but obviously there are implications for the acute trusts around fall services, avoidable admissions, preventing frailty in older people. So thinking about that, obviously the overarching kind of framework for the city is the Health and Wellbeing Board agenda between the local authority, led by Bristol City Council, but shared across the city. So, do your priorities, does your HIT map onto those sort of areas is really important. I think the NHS is a really complicated place, and it's getting more complicated, not less complicated, I think, with the new structures. This is the official map from the Department of Health of the health and social care system. So, finding a way around the clinical commissioning group, who's talking to the commissioning group, what the commissioning support group is, what the different trusts are, who's providing community services. It's really complicated. And again, I think Bristol Health Partners can be a helpful sort of route map through trying to work your way through who the key players are. And they obviously keep changing. I mean, one of the challenges, I think, is that the clinical commissioning group is a really key organisation, but it's a very stretched in terms of its capacity. They're really working flat out to deliver their services. So they're keen to engage, but actually working out who the right person is and whether they've got the time is really quite difficult. Obviously, I think you need to be thinking about who are the funding sources for your HIT, what sort of organisations are going to be funding the work that you're interested in doing. And that's obviously the NHR and research councils, but it might be also about, does your work align to local business changes? If you're working in mental health services, AWP have just gone through a major tendering organisation, completely redoing the way that they're running, delivering their mental health services. There may be some funding available from Health Education South West around educational type initiatives. There's obviously charities, local and national, and there's a variety. I mean, Jenny and Richard are going to speak later, but there are a variety of other different funding opportunities that may be linked to research or quality improvement cycles. So it's worth having some idea of where the natural funding sources are for those things. So I think some of the first things is thinking, is there actually potential here for something, or should we just carry on doing what we're currently doing? Then there's sort of trying to map out who the key players are in all the different local organisations. I think there's something, the way we did it was we had a kind of quite open scoping meeting really to see whether people were enthusiastic and whether there was energy around that. I think getting some high level buy-in from the organisations who you want to work with is helpful if you can achieve that. Writing the application form, I mean, it's not the worst application form I've ever written, but it is quite demanding. You do have to think about it, and I think you need a small, dedicated, you know, you'll have a great big group of people who all think it's a great idea, but actually the people who actually sit down and write the application form, as in any of these things, grants, whatever, it's quite small. So you need to have a small group who are really willing to put the time and energy and effort into thinking about that and sorting out the detail. So I think some of the issues, I would say, finding the right people is quite difficult. Finding the right people within the institutions who are interested in your area. You know, if you know them already, it's easy, but if you don't know who they are, finding out who they are can be quite tricky. Writing the form, thinking about 5-year plans, 3-year, 6-year plans is, again, quite challenging. And you do need to have a small group, and obviously that group needs to be across a couple of institutions, so you need to have buy-in from a number of different players.